Hello, welcome. I am Dr. Steve Hamilton. I am the Medical Director of the Emergency Department here at Texas Health Hughley Hospital in South Fort Worth. I thank you for joining us today. Today we are going to talk about our cardiovascular chest pain center here at Texas Health Hughley. We also want to educate you about signs and symptoms of having a heart attack and also give some information on ways that you can reduce your likelihood of having a cardiovascular event. So with that in mind, it's very important to note that about 1 in 4 deaths each year is attributed to someone's cardiovascular disease. So with that in mind, if you are having symptoms of a heart attack, we want you to quickly call 911. Some of those symptoms may include chest discomfort in the center of your upper torso. Oftentimes this chest discomfort will radiate up to your jaw, to your shoulders, to your back, down your arms. Other symptoms you may have in addition to that chest discomfort is you may feel very lightheaded, you may break out in a sweat, you may become real nauseated. So if you have those, please call 911. If 911 arrives at your place, whether it be at home or work, they will quickly transport you to an emergency department. Here at Texas Health Hughley, our emergency department is well equipped to handle your cardiovascular needs. Our staff and our nursing providers will quickly obtain an EKG. If that EKG does show signs that you are having an active heart attack, we have a comprehensive chest pain center to take care of your heart attack. You would quickly be transported to our heart cath lab, where our cardiovascular team will open up those blood vessels to preserve your heart health. With those things in mind, we'd like to educate you of ways that you can limit your risk for having a heart attack. Things you want to do is you want to meet with your primary care provider to make sure that you do not have high blood pressure. If you do, find ways to control your high blood pressure. Also, you want to make sure that if you have diabetes, to control your diabetes. You also want to not use tobacco products. You want to get good aerobic exercise. You also want to try to limit your stress and anger. Some things to keep in mind: we talk a lot about symptoms and signs being different between men and women. Oftentimes a catchphrase is that women will have some kind of non-classical findings, and those symptoms may still be attributed to a heart attack. So we commonly talk about chest pain being in the center of the chest or off over here to the left side, but women often will have pain on the right side of their chest, or they may just have some real subtle signs, whether it be the nausea, the lightheadedness, the shortness of breath, and that too could be attributed to the fact that you could be having a heart attack. So please keep in mind that if you are having those symptoms we talked about earlier, that here at Texas Health Hughley we